So, welcome to my podcast today. I have a very special guest who has, I believe, had one of the biggest, if not the biggest, hair transplant in the UK, combination of FUT and FUE. He's also gone through a dramatic transformation with his own weight loss as well. I think dropping around about 50k, I think in total. We'll confirm that with him in a moment. But welcome to the podcast, Mike Denman.
Very much. Good to be here.
Yeah, thank you for coming along. And so you set up your own online coaching and called the Fit Dad program, and you've set that up over the last 6 months or so. Is that correct?
Yeah, that's right. Yeah. Yeah, like you say, I kind of went on a pretty big kind of fitness and weight loss journey myself, and then got to a place where like I had developed a lot of knowledge and obviously through my own trial and error and through reading and things like that. And yeah, so now I'm helping loads of other dads try and do the same thing.
And what was that defining moment that made you decide that you needed to do something about your weight?
So it's 2021 exactly. I can tell you pretty much the date, early September. I think it's like 3rd or 4th of September, something like that. My wife and mother-in-law took my daughter to a garden centre, and as they were walking around the garden centre, my 2-year-old daughter ran up to a Buddha statue, and we're talking about the fat, bald Buddha statue, not the young, peaceful Buddha statue. And she ran up to it and cuddled it and shouted "Daddy" at the top of her voice, um, which obviously was very entertaining for my wife and mother-in-law, and they sent me a photo of it. But that photo was literally flipped a switch, and no exaggeration, from that day onwards, like I was almost a different person, like gradually, bit by bit, but it completely changed my mindset. I just, 'cause I was very overweight. I was approaching 150 kilos. I didn't even have
Okay.
scales at the time, so I can't tell you exactly, but I was
And
very
and
overweight.
old money. What's that? 150 kilos.
About 23, over 23 stone.
Wow.
Um, so yeah, I'm 6'3" for context, but
Mm.
that's too heavy for anyone. There's no one who can justify being 23 stone. I think it's more like 23 and a half.
Okay.
Um, so I was big, and yeah, I just got to the point where I thought, this isn't good enough. I need to do something about this.
And at that time that you were that weight, I mean, were you doing any exercise at all? I mean, did you do any kind of like walking
Really. I
or
mean,
gym work?
walking the dog, that was
Right.
no kind of conscious exercise. Yeah, the only thing I did was walk the dog, really.
Okay. And for how many years had that been? So you're 45 now. So we're talking that moment happened in 2021, so 4 years ago. And so you were over 40.
Yeah,
Did you see your weight sort of gradually pick up over the years
it did,
or?
and it's kind of gone up and down. I've been through phases where I've been lighter and phases where I've been a bit heavier. That was definitely my heaviest in
Mhm.
2021. COVID did it was a contributing factor for sure. Because I was a chef at the time, so furlough, all that kind of thing
Right.
at home, eating. We took when we closed down the restaurants, there was loads of food that obviously was going to go to waste. So I had a freezer full of meat, and I was at home bored for however many hours a day with a young daughter. My wife was off as well, so yeah, I just sat at home eating large pieces of meat essentially for over 6 months, and then it just continued and spiraled from there.
Was there anything sort of thing that you would go to as your guilty kind of like pleasure at the time? What was the thing that you would turn to food
To
wise?
be honest with you, I was completely out of control. I would go to walk the dog, and on the way there, I would stop at a newsagent and buy like a bag of Maltesers, a bag of crisps, maybe an extra bag of other sweets, a chocolate bar, something like that. And I would eat all that stuff whilst I was walking the dog, and then, stash it in the bin somewhere, because obviously that's fairly embarrassing behavior,
Hmm.
and carry on like that. And it was completely out of control. I would go to McDonald's at mid-afternoon, order 2 burgers, a portion of chips, a milkshake, eat that, and then go home and have dinner at 6, 7 o'clock. It was absolutely no control whatsoever.
And were you hiding your food then from your wife? So it was a bit of felt
Yeah,
this sort
no,
of
I mean, she would
shame.
obviously see the
Yeah.
portions that I would have in the evening,
Yeah.
and But there was definitely times, yeah, all that kind of McDonald's random eating, and the sandwiches that I'd grab on the way home, on the way to the train station, all that kind of thing. It's not really something I would talk about. I would stash it and drive home with the windows open after I've been to the drive-through and get rid of
Mhm.
the wrappers. It's definitely a very kind of dysfunctional relationship with food for sure.
And so that went on for years, and then you had that moment in 2021 where you decided you were going to make that change. But I guess being a chef is like that's such a difficult because food is everything, isn't it? You've got to taste the thing, so obviously it must be very difficult.
It is hard, and there's no barrier between you and food when you're a chef. You have to taste things because it's your job, but
Mm,
you also have access to anything you want at any point. If you want a bowl of chips, you can have a bowl of chips straight away because it's right there in front of you. And you also get into the habit of picking a lot. So when
mm,
there's always bits of food everywhere around the pass, or you can just pop into the pastry fridge and grab a little chocolate truffle or whatever you feel like. And if you put all that food on a plate at the end of the day, it would be an enormous amount of food. I bet combined tasting and picking combined would be a huge amount of
mm.
calories.
Yeah, yeah, absolutely. So, did you ever have an idea of what sort of calorie intake you may have been before you changed your ways?
Really, it's really hard to. I would have only ever really tracked calories when I was actively trying to lose weight. So,
Yeah, of course.
but it would have been like there would be days that would be well over 5,000,
Yeah.
probably, yeah, even six, seven potentially. Not necessarily every day, but there would certainly be days where I would have eaten that much.
I guess you say you're 6 foot
About six
three,
foot three.
6'3", yeah. I guess being 6'3", you're able to carry it a bit easier than if you were sort of 5'10", five
Yeah, a
foot
little
nine.
bit. I've always been, even when I'm
Mm,
kind of a reasonable body fat level, I'm still kind of quite broad and well
mm,
built. So, yeah, kind of, you don't notice it creeping on at the start because it just kind of, like you say, you carry it, but there comes a point where you just look very overweight, whether
yeah.
you're, 6 foot, no one should be 23 and a half
No.
stone,
No.
regardless of how tall they are.
Absolutely. And so you made that change, you made that decision in 2021. So can you remember the first thing you did? Was there like, right, I'm going to join the gym, I'm going to go out for a run, I'm going to pick up some weights?
I think it started more with food. So the first decision was
Right.
I need to cut out all this snacking and all this
Yeah.
mindless eating, and just obviously being a chef, I have a reasonable idea of how to eat healthy food. I know what's healthy and what's not. I was just choosing to ignore all those facts.
Mhm.
Um, I didn't join a gym until November, and I started at a small kind of personal training gym. So I'd already lost a little bit of the weight, probably a stone,
Okay.
and it was a small group personal training gym. So I was working quite closely with a couple of really good coaches, and that really kind of set me off on the journey because you learn a lot about how to do things with the right form and the right amount of intensity, and you don't learn a lot of good technique. So I would definitely recommend anyone who's new to fitness to work with a coach, whether that's in person or online, who can check that you're doing things properly and giving you a program that's suitable for you rather than just running into the gym and jumping on
Mm.
whatever machine's free. And before you know it, your shoulder hurts, you've done your back, knees are aching, and then you think, oh, exercise isn't for me, this is no good. So I would definitely recommend going
Yeah.
the sensible route.
And with regards to you obviously made this decision then, but had you been through this in the past where you'd got to the point where you're like, you know what, I'm too big now, I need to do something, and then you'd failed and then gone back to your old lifestyle?
Multiple times, yeah.
Yeah.
So I lost quite a lot of weight while my wife was pregnant with my daughter. So my
Hmm.
daughter was 2 at the time, the most recent time I did it in 2021. But I'd lost quite a lot of weight while she was pregnant, and then obviously COVID had happened almost immediately after that, so the weight went back on. But even, yeah, going back over the years, when it's generally either when I've split up with a girlfriend or some other reason that I wanted to, look good. Um, and then you end up not really doing it for the right reasons. I think that's
Yeah.
one of the biggest things is you have to do it for long-term reasons. If you do it for, oh, I want to lose some weight for this holiday, or I want to lose some weight for this wedding, or
Wedding, yeah.
that was another time, yeah, I probably
Mm.
lost about 4 or 5 stone before my wedding, but you're just not doing it for a long-term reason because okay, great, you've lost 5 stone for the wedding and now the wedding's gone, so now what? And then you just end up creeping back on.
Yeah, I think it's always the thing. I can totally relate to that because I've sort of not yo-yo dieted, but I've lost weight over certain times in my life for weddings, or generally when you're single, you're at your lightest because you don't have that need, I guess, to cook big meals and you don't have these big portions. I think there's always a danger when you get into a new relationship with somebody and then you start to go out more frequently to have meals and you cook meals together and then before you know it, you've kind of like put on that weight that you've lost after about the first year of a relationship. That's what I tend to find.
Yeah, just get a little bit too comfortable, I think.
Yeah, yeah.
So by 2024 was my probably where I hit the point where I thought, yeah, I'm pretty much done
Mhm.
here. And I was about 17 stone at that point. So
Okay.
um, yeah, it was about 50 kilos, about 8 stone in total.
8 stone, wow. And did you have a target? I mean, I guess you didn't at the time. You just wanted to be healthier and you wanted to be able to sort of like, not be referred to as Buddha by your child.
Yeah, exactly. And it's more like I didn't really have a target in terms of the weight. It was more the kind of health and the
Mm,
longevity and just getting down to a point where I felt like I was lean enough to say that I'm healthy. And also, with the fitness, just not being out of breath, being able to run around, jump up and down off the floor, all that kind of thing. It's
yeah.
more about that. And also about being able to do that with any potential future grandkids,
Mhm.
into my, whenever grandkids come along, I'm going to be 70, 80 probably by the time all the grandkids come. So, I need to be able to at least be useful at that point. And, you don't get that without a plan.
When did the hair loss start for you? At what age were you?
So it was early 20s really, and I hadn't really noticed it at that time. But now looking back at old photos, definitely you would say it was starting to recede. It was starting to go kind of around the normal places where it
Yeah.
starts to go. It wasn't really something that I was sort of consciously noticed until I would say late 20s, where it really had started to recede, and there was a little bit of balding coming in the crown. And you just start to see like the odd photo of the top of your head for some reason. You think, oh, actually, yeah, I'm going a bit bald there.
Mhm.
Um, but never really. I think because I was out of shape generally, it just didn't really occur to me at that time that it was something that I wanted to do something about. I think I kind of very vaguely looked into medications in my kind of mid to late 20s, and obviously the first thing you find out about when you look at finasteride is the fact that you'll never get an erection again and your sexual health will disappear. um, which had I looked into it more, I would have found that that's not
Yeah.
often the case or very rarely the case. But I just never really thought about it again after that.
So do you think it was a lower priority because you just, when you looked in the mirror, you didn't necessarily like what you saw, and life was obvious. Life can be busy, and you think to yourself, well, okay, yeah, I'm losing my hair, it's thinning a bit, but I don't have the motivation again to lose weight. I don't have the motivation to do anything about my hair. Was there a little element of that?
Yeah, I think it was, and I just ended up at the point where I would literally just get a grade 2 trimmer and just shave the whole thing, like beard, hair, everything, and just kept it at that length for years. So, I just didn't really bother with it. But I think you're right. I think it's connected to your general health and just the way. I wouldn't say it was something that I'd ever been happy about. I wasn't,
Mm.
delighted to be losing my hair, obviously, but it wasn't something that specifically bothered me over and above the rest of my appearance.
And so you took the decision when you started to notice that your hair was generally thinning, because you obviously you'd lost everything through the top by
Yeah.
the time that you had your transplant, but you went through that stage of probably the corners receding, being a bald spot on the crown, and then generally losing volume on the top. At what point did you suddenly say, "Oh, do you know what? I'm going to just shave my head"? How many years after that?
Mid 30s, something like that.
Okay.
It was just getting to the point where it was impossible to hide it anymore, and it just started to look a bit silly, really. Um, so I just went for, I did it before I went on holiday. I just went for a grade 2 all over and never changed it from there, really. I think the first time I did it, I got it done at a barber's, but then after that, I just thought, well,
Mhm.
what's the point? I'm paying someone to just do
Yeah.
that with clippers.
And did you find it liberating though, once you shaved your head?
In a way, but I think, yeah, I don't know. I wasn't really paying attention to it that much at the time. It
Right.
was, if anything, it was just convenience rather than appearance.
Did you have an element of like, well, this is saving me money on a haircut?
Yeah, I think that was probably the only thing. And I don't think, there wouldn't be anything really a barber would have done that I wasn't doing at the
No.
time. Like, there's no real way of making that look better.
Yeah, well, I think it is a good option for men, to just buzz their hair. But I think that some men look great. They look great with a shaved head, and it really suits their head shape, and they've got the right proportions for that. But other guys, I still feel that it's just making the best of a bad situation when they shave their head, and they would always rather have hair because it frames your face, and you look like a completely different guy with a hairline now and covers than what you did obviously when you lost all your hair. And obviously aging as well. You look different with hair. Everyone does. But
Yeah,
so
definitely.
just tell us a little bit about, so you were shaving your head and you were living your life and then you got yourself into shape. What was the defining moment that made you think, I want to get a hair transplant?
I think it kind of crept up, and I must have looked at something on Instagram or something like that, and the ads start following you around as they do, for medication to potentially restore your hair. I kind of thought, yeah, that'd be nice. That'd be good to have a bit of hair. It wasn't at that point. It wasn't like I need to sort this out right now. So I just gave the medication a go. Um, Obviously, it was too far gone by that point, really. Like, there's very few, if any, people that actually get any kind of, restoration from the medications. I would say it did something, but
Mhm.
it certainly was never going to restore it to a level where I would think, oh, yeah, okay, that's great now. Um, it definitely hasn't got any worse, around the sides and the back, but it was a pretty minor improvement. You would definitely still look at me and say, "Yeah, that guy's bald."
And
Um,
so you jumped on finasteride at that time.
yeah, so I started on like a minoxidil solution and oral
Okay.
finasteride. Yeah,
Right, together at the same
yeah.
time. Okay. And that was through sort of doing your own research in terms of looking at forums, or was it just sort of Googling and understanding, or did you go for a consultation at that time?
I did a consultation through Manual, the
Right.
like men's health, because I
Yep.
use TRT as well, so it kind of came. All the sort of marketing came through that, through having looked at Manual. Yeah, and then I had a consultation with one of their hair guys, and he was very honest. He said, look, this isn't gonna, you know, drastically change your hairline, but it's likely to stop it getting any worse.
Yeah. Well, that's good advice that you got on that. And you did that for like a year or more, did you, before you actually then started to consider a transplant?
I think it was probably about 6 months in that I started
Right.
to look at a transplant, just because I came to the kind of conclusion that almost what's the point? Like, it was so far gone
Yeah.
that I got to, what am I actually saving here by
Yeah.
taking this medication? Like, it was probably at least 80% gone. Like,
Yeah, I
what's
think
the
that's the
point?
difference, isn't it? There's some people, if you catch it early, and then you can actually, recover so much of your gain, so your losses with medication, that you can avoid the potential of having a hair transplant. But I think by the time that you'd got on finasteride, you just left it too late. In hindsight, is that something that you regret? Is sort of not looking into that earlier?
Yeah, I bet you hear this every day. I wish
Oh
I'd
yeah,
started the meds earlier. Yeah, absolutely. If I'd have started those when I noticed, even maybe mid-20s, something like that, then yeah, it could have been very different, right?
yeah. Well, you could have avoided having the hair transplant if you'd held onto your hair, and I think it's such a shame that there is, and particularly was, so much fear mongering about finasteride, about the side effects, about the ongoing persisting side effects, that it just puts you off. And you were worried about the sexual side effects in terms of libido, sexual dysfunction. So you'd read about it a bit online, and that had that had put you off
Yeah,
initially.
exactly. I mean, that would have been kind of early 2000s
Yeah.
before kind of social media had really got going, I guess. But
Mm.
or certainly to the extent that it is now. But yeah, I just sort of looked into it, and then it says potential side effects, and then you read a few things on forums and things like that, and you just, when you're in your mid-20s, you think, no, thank you. But actually, if I'd have done my research at the time properly, I don't know whether that information was available at the time and easy to get hold of. I don't know, but
It
yeah, it's
wasn't.
certainly something I kind of
Yeah.
look back now and think I could have saved myself a lot of money, and b a lot of years of baldness.
Yeah, yeah, I think it was available, but I think there was. I was talking to Tom Gilbanks, who's blown up huge on the socials, talking about finasteride and medication because he's had a great response. He got on it at a really early stage. So unlike you and I, who sort of procrastinated, were put off by the worries of the side effects. I mean, I took 12 years before I got on finasteride. I started noticing my hair loss at 21, got on
Yeah.
finasteride when I was 33.
And was
So
that after you'd already had transplants?
I already had three bad transplants in the UK at that time, at the age I was 23, 24, and 25. So I had three strip scars, and I was continuing to lose more hair and had this sort of patchy distribution of hair. And then my hairline kept on creeping back until I could see these big old mini and micro ugly looking grafts that they did in the 90s, or they're still doing them, unfortunately, in certain clinics around the world. So yeah, my biggest regret was not getting on finasteride earlier, and listening to all the negativity that was online. It is so much easier to get hold of, and there is such a wealth of information for guys losing their hair now. So I think people don't need to do what you and I did. They can get on medication, save their hair, avoid the need to have a hair transplant.
Absolutely. Let us be a warning to you.
Yeah, totally, exactly. Don't these young guys in their 20s have got all the information that's out there available for them not to make the mistakes that we did. And let's talk about TRT. So when did you start TRT?
So it's quite late in the kind of weight loss journey. So I got to a point where I'd lost at least 35 kilos. I'm not sure exactly of the
Hmm.
number. It was, yeah, somewhere between 35 and 40 kilos, and still just didn't quite have the sort of drive and energy that I wanted. So I ended up getting a test, like an initial blood test, and that came back as low. And then what
Right.
happens then is you get another full blood test, because the first one's a kind of finger prick, and then you get an actual blood draw to double check the result essentially. Um, and that one also came back. It was actually lower than the first one. Um,
And
so
sorry, did you go through that privately at all? Or did you just do that through your own GP service?
that was through manual.
Oh,
Um,
through manual, right? Okay.
so there's a bit of kind of discussion as to how kind of involved the NHS are with kind of treating low testosterone. I think their thresholds are quite low, and they'll kind of turn down a lot of men who do actually have symptoms of low testosterone. That's
Hmm.
a separate conversation, of course. But um, yeah,
But
I've got to the point where essentially now, if you have low testosterone,
yeah.
a lot of people will tell you improve your sleep, don't drink so much, exercise, lose weight. And I was at the point where I'd done all of those things. Like I'd given up drinking completely. I was exercising, 5 days
Mm.
a week at least. I'd lost a, large amount of body fat. My sleep was great. My stress was low. All the things that can impact it outside of just having, medically low testosterone. Um, so that was the point that I, decided to give it a try. And yeah, it changed things really quickly. Not so much with the weight loss, that kind of just
Yeah.
continued, at the same rate that it had. I would say it probably does help you to build muscle when you have the right level of testosterone, whether you do that um, medically or whether you improve it with your lifestyle. Like you will find it easier to build muscle when you have more testosterone. That's just what it
Hmm.
does. Um, but definitely in terms of mood, libido, all that kind of thing, that improved pretty quickly within a couple of months. The way to do it, I think, is small doses. So I do it twice a week, a small dose. So I take roughly 90 milligrams, which is a pretty low dose even for
Hmm.
TRT. Just because I want to be at an age appropriate level. There's plenty of clinics that will prescribe it to you, A, arguably when you don't need it, and B, they'll let your testosterone get fairly high, which isn't really what I'm doing it for.
No.
I just want to be at a kind of healthy, age appropriate level.
Okay. And at the time when you did the, because it was done through manual, did they also look at your DHT levels as well?
I don't think they test for DHT.
Mm.
Um,
Right.
Obviously, the extra testosterone like can increase that.
Of course.
And they did mention if you start noticing hair loss. When I did the initial consultation, and I essentially said, "Well, it's a bit too late for that, mate," because I was basically bald at the time. Um, but then it kind of when you start realizing that actually it's an option to have your hair back, I think that was one of the deciding factors. Is I'd already told myself that I was just going to be bald and that was it.
Yeah.
And then when you realize that actually there's a chance that you could get hair back through medication, you think, oh yeah, maybe I'll give the medication a go. But then you start getting attached to the idea. And then when the medication doesn't work,
Mm.
then you think, oh, okay, so now what's the next option?
Did you get on the TRT prior to finasteride, or did you start
Yeah, so
finasteride?
I was on it for about 6 months before. And I didn't
Okay.
notice any additional hair loss really, because my testosterone levels were never that high. I deliberately kept them at a pretty kind of moderate level, so I didn't notice any additional hair loss. Not that I was particularly checking for it, because, like I say, I just assumed that that was it, and I was bald.
Yeah.
Um, but yeah, then once that seed gets planted, then you start kind of giving it a little bit more thought, especially at the point where I'd lost the weight,
Hmm.
um, and just sort of started getting a bit more interest back in my appearance in general. Then it starts to become a bit more of a priority. It starts to move up the
Yeah.
priority list a little bit.
Definitely. I was just curious because obviously people talk about getting on finasteride lowers their testosterone levels, and that's one of the things that they worry about greatly. So it was interesting that you'd already noticed that your testosterone levels were a little bit lower, and you were treating yourself with TRT before you got on finasteride.
Yeah,
And that's the interesting part, because obviously I know people over the years I've done consultations with who have got on TRT and then suddenly seen increased hair loss, but it may be that they're having too high a dosage. So they go to the doctors, they got low energy, all those types of things, a bit overweight, and they get on TRT and they say to me, I felt fantastic. But the trade-off from that is you're seeing increased hair loss, which is where finasteride comes in so well as a way of managing that.
yeah, definitely, and it can manage your and any other kind of symptoms that I had in that sort of regard. I've also taken tadalafil, so I take a small daily dose of tadalafil. So
Okay.
it kind of I didn't notice any difference whatsoever in terms
Mhm.
of the TRT or finasteride in any of this, any of the warning symptoms. I didn't notice
Mm.
anything at all.
Good. And just going a little bit about the weight loss, because you lost like nearly 50 kilograms. So, first of all, it must have cost you a fortune in new clothes.
Yeah, I replaced my wardrobe at least twice. I went from double XL down to, I think I skipped XL and went sort of straight to large in some things. Some
Okay.
things you have to replace, there's not really any stretch in a suit, like a bad fitting suit just
Yeah.
never looks good, does it? Whereas you can kind of get away with a pair of jeans or something and you just do your belt up a bit tighter or whatever. But yeah, in most clothes now I'm down to medium. So I've gone from 2XL down to medium. Um,
Wow.
which is, yeah, it's not cheap, I'll be honest.
Yeah. And what about your waist then? What jeans were you wearing prior to
I was
what was
up
your
to,
centimeter?
I think I was up to 44-inch jeans
Yeah.
and not wearing them on my actual waist. I was,
Right.
wearing them under the overhang.
Yeah.
Um, but now
Always a nice look.
30. Yes, absolutely. Covered with baggy hoodies and t-shirts,
Yeah.
obviously. And I'm 34-inch jeans now, so
Wow. Okay.
it's a
Cool.
pretty
And
pretty
did you
big.
find it
And
had
also wearing them in the right place now as well.
yeah, yeah, of course. Did you find you had a general change in your energy levels? Obviously, it must have done, but your mood, was there a real change in your personality and after losing that much weight?
Yeah, I think so. I think it's just about, like you say, just having the energy to, especially
Mm.
when the kids are around, I'm
Yeah.
45 and I could easily be, and I speak to dads every day who are, asleep on the sofa by 6 p.m. and just don't have
Mhm.
the energy, or, the kids want to play and they kind of divert them into other activities. But, obviously I still get tired sometimes, I'm busy
Yeah.
and everything, but generally speaking, I have loads of energy to interact with the kids, and there's no kind of afternoon nap or anything like that. And that ultimately that's what I did it for.
You can help me answer this for me now. So around about, so you've cut out alcohol, which is I think is commendable, and a lot of people are moving to that. I think the younger generations, it's not even really a thing. But I think for guys of our age, perhaps have grown up with alcohol as being a
Yeah,
major part.
yeah,
And
definitely.
that's a major part of socializing, isn't it? You go and meet your friends at the pub, used to go out clubbing, binge drinking, all those sorts of bad things. And it kind of drinking stays with you, where younger generations are saying no to alcohol right from the start. But moving back on to the search for fixing your hair with your hair transplant, and just tell us a little bit about your research that you did. Did you have many consultations? How did you go about finding the doctor that you went with?
So once I decided to get a hair transplant, my first thought was, well, I'll just go to Turkey. So
Right.
I Googled, best hair transplant available in Turkey and all that sort of thing. Looked through all of their websites and things like that. Did a bit of research.
Can I change that? Why did you
Yeah,
think that the first thing was like Turkey? Because that's what you kind of knew as a person who hadn't looked into it at all. You just thought,
yeah. I guess the only thing I'd really heard about in terms of hair transplants, obviously I knew there probably were people doing them in the UK, but I just assumed that that's what you did when you wanted a hair transplant, and so
wow.
that was the first thing that came into my head when I googled it.
And you'd not any friends or colleagues who had a hair transplant that had opened up to you about it at all that you knew of?
No, funnily enough, I didn't. I think everyone I've spoken to since knows someone who had a hair transplant. I didn't.
Hmm.
So I didn't really have any kind of, one-to-one advice to go on.
Yeah.
And the only thing I'd really heard about is Turkey.
Mm.
So yeah, I looked at all the websites and I couldn't find anyone on their before and after photos that had the same level of hair loss that I did. And the very few that did, I would say, didn't have a particularly good result. And I was fairly adamant that I wouldn't do it if I had to split the procedure. I didn't want to, spend a year with the front filled in and the back completely missing. Um, so then, obviously, if you're in that position, then that kind of narrows your options fairly
Yeah.
considerably. So I did have some consultations.
Hmm.
I had some at Westminster and Fargo and one other HQ in Cardiff. Those initial ones before I ended up speaking to Dr. Ted had all kind of been fairly tentative. Like they were all very honest, and I think, they'd have all done their best, but none of them just gave me the confidence that I would get the result that I was looking for first time. They were all kind of talking, in the kind of five, maybe 6,000 graft area. We'd do our best to fill in the crown, but obviously we'd concentrate on the hairline and the mid scalp, and then whatever we can get to fill in
Yeah.
the crown, we would do.
By the time you had your hair transplant, I mean, you'd lost extensive amount of hair. You were, I think, looking at your photographs, you were somewhere between a 5 and a 6 on the scale, probably more a 6.
Yeah, I would say closer to six. Yeah.
Yeah. And so I think that's quite, ambitious to try to restore that all in one go. So your expectations were, look, if I'm doing it, I'm going to do it all. And I don't want to really mess around by restoring the front and then having a ball crown. And did you not could you not get your idea around thinking that having hair at the front would be better than nothing? You didn't like the idea of just a sort of like
No,
a
my
ball
position
crown.
was almost that it looks worse, and I didn't want it to look worse for a year.
Hmm.
Um, I feel like just being a Norwood six is just you just look like everyone else who's gone bald. If you've got a really thick frontal section, mid scalp, all that kind of thing, and it looks perfect. And then nothing at all in the crown. In my opinion, that looks worse than just being a norwood 6. So it wasn't something that I really wanted. I know plenty of people do it like that.
Yeah.
And you can, the long-term result is probably the same, right? Like you still get to
Yeah.
where you want to be if you go back for that second procedure.
Of course, but not. I mean, not everyone who's a Norwood 6 has got the great donor area to be able to do that in one procedure or even in two procedures. So, a lot of guys will have a two-piece procedure where they have the front done, and then they might have enough to do a bit of light coverage into the crown,
Mm.
or they might feel that there isn't enough. And it can be quite rewarding for patients to see themselves, because it's what you see when you look in the mirror. You've framed your face, you've got hair here and front on. I could look like a guy who's got a good head of hair. But obviously, on the same token, some people don't like the idea of having a bald crown, or they don't like the idea, like yourself, of having a second procedure. So your expectations were pretty high. So in terms of,
Yeah, I'd
and, and I guess
drastically limited my options.
for you, it wasn't a case of like, you know, I really need to have hair and I'll take any type of hair than nothing. You were got from talking to you, you were the kind of guy who was like, it bothers me, but yeah, it's not the end of the world. And you'd obviously fixed the biggest issue, which is you lost this weight, you built muscle, and you were feeling good and you were buzzing your hair. So it was like, in some ways, it's been a bit like the cherry on top of the cake, getting the hair transplant.
Yeah, that's exactly what I was about to say. Yeah, it was just the extra kind of finishing touch to.
Yeah.
I think the whole driving factor for everything is that I had a bit of a stigma after having a kid at age 44
Hmm.
about being an old dad,
Right.
and I'd kind of fixed physically everything that I could fix, but there was something left that still made me look like an old dad, which I couldn't fix myself. So it was something that I thought, yeah, that would be really good to achieve, but probably not at the expense of having that gap in between the first and second procedure of, whatever you leave it, 12 months for argument's
Yeah.
sake, and then plus the regrowth, obviously. You could be looking at what, 2 years between,
Yep.
you know, those two positions, and I just didn't want those 2 years at that point in my life when I had the young kids. And, part of the reason of doing it, not that I think the kids care in the slightest, but just of that, them having that image of their dad. And I didn't want that to be, like the old bald guy. Um,
Yeah,
so that
I
was a lot
think.
of the driving factor.
Yeah, I think probably when they're young, they probably don't care, do they, so much? But probably as they get older, I guess it's the slightly older dad who's overweight and got no hair, and that could be something that might affect them a little
Yeah.
bit.
Yeah,
Um,
yeah, I guess so. Yeah,
yeah,
yeah, you're right. At this age, I think they just accept it. You're just their dad, and they couldn't care less, right? But
yeah,
um, yeah, it's more to do with my perception of what I think they might think either
mm.
now or in the future. Whether that's actually true or not, I don't know.
So you had a few consultations with a few clinics, and then you found Dr. Ted.
Yeah,
Um,
so I found one of his procedures on, I think it was on Hair Restoration Network, or I'd Googled it and seen the image, or come across his website, something like that. And there was at least two or three of his previous patients who I looked at and thought, actually,
mm,
yeah, that's pretty much what I look like.
yeah.
And they'd had the full coverage in, in one procedure, which is exactly what I wanted. So, yeah, I'm quite kind of lucky in a way that I came across him because I was fairly close to giving up, I guess.
And during the consultation, I mean, did you get 7,000? What was the final number of grafts that you had on the
It was
on the?
7,848 was the
Okay,
final
which,
number of
which
grafts.
we think is the UK's biggest hair transplant, and it was a combination of FUT and FUE over 2 days, wasn't it?
Yeah, that's right. Yeah.
Yeah. Okay. And during the consultation with Dr. Ted, I mean, I'd be surprised if he would imagine, having worked with him, that he would have said, "Oh yeah, we're going to get over 7,000 grafts." I suspect he sort of felt that maybe, what did he plan for, 5,000? Was it over 2 days, or
Yeah,
was it?
he said he'd aim for at least 5,000, maybe
Yeah.
six if we were lucky, essentially.
After the consultation with Dr. Ted, how long did it take you to make your mind up that you wanted to get that done?
Oh, pretty much immediately. I think I booked it following day.
Right.
I'd already done a fair amount of research before we had the actual consultation, and I was fairly confident that he was going to say that, a combination of FUT and FUE was how he would do it, which obviously he did. And I'd already looked at a lot of the results from those surgeries that he'd had. And yeah, I'd almost decided before the consultation that if I was going to do it, then it was going to be with him.
I hope you're enjoying the video with Mike and you're finding it interesting. Perhaps you're sitting there thinking to yourself, how did this guy get 7,848 grafts? I have to say, I'm not a big fan on huge procedures, particularly by FUE alone. There is a risk of that you deplete the donor area in one procedure. You don't have any hair to chase ongoing future loss. Plus also the graft survival rate. Will that be as good as perhaps breaking it down into two smaller procedures? Now, I had a big FUT procedure done 20 years ago, actually, to this year. In 2006, I had nearly 5,000 grafts transplanted. Now, choosing your patients for these big procedures wisely is the most important thing. First thing to say is that Mike had stabilized his hair on medication. He'd been on Finasteride for a period of time. However, he had lost the majority of the hair that he was going to lose. He was losing his hair in a Norwood 6 pattern. The other factor that we've heard in this interview is that Mike wanted to achieve all of this in one procedure. He didn't want to wait 2 years by doing the front and the mid scalp and then the crown in a separate procedure. Obviously, he had high expectations. He wanted to accomplish it all in one procedure. So he actually said, I wouldn't go ahead with it if we couldn't accomplish as much as we possibly could. So if we break it down, day one was FUT only, and his strip yielded 4,351 grafts. Numbers of hairs, 9,193. So that gives us an average of 2.1 hairs per graft, which is pretty much bang on average what you'd expect, 2 hairs per graft when it comes to FUT. So how did they manage to achieve 4,351 grafts? Mike has exceptional density. I'm told his density is 100 grafts per centimetre square, which is above average in terms of numbers. Mike is also a big chap. He's 6'3", and therefore he probably has a slightly above average head size, and that is indicated by the length of the strip being 28 centimetres. The width of the strip that was removed was 1.5 centimetres. So if we calculate that out, roughly speaking, that gives us around about 4,200 grafts. The number achieved was 4,351. So often with FUT, and not always, some clinics will just shave the piece of tissue that they remove, and you're encouraged to wear your hair a little bit longer before surgery, so that when the piece of tissue is removed, the hair covers the scar, stitches, staples, whatever you have after surgery. Now, when you're doing a hybrid procedure, you have to shave the entire head. So it's pretty full on when it comes to these procedures. For Mike, the recovery, I expect, was months to allow that hair to grow back and cover the scar. So for a few months, he would have had to have gone about his daily life with a strip scar on display. If we look at the second day procedure, which was the FUE day, he actually got 3,497 grafts. Again, that's quite a big number, particularly when you look at having over 4,000 grafts removed by FUT. But Mike is a tall chap, slightly above average head size, so therefore he's got a larger area that you can extract from when it comes to FUE. Interestingly, the number of hairs extracted by FUE was 9,013. So his actual yield was 2.3 hairs per graft when it comes to FUE. And that's quite normal because with FUE, you are able to cherry pick. So you're able to target the 2 hair grafts if that's what you need, target the 3 hair, 4 hairs and so on. Whereas FUT, you remove a strip of tissue and you are given what you are given. So you have to accept you're going to have a range of 1s, 2s, 3s and 4s and so on. So that's basically it. What do I think of it? I think he's got an incredible result. I think it was very appropriate for this particular patient. When you are looking to carry out these big procedures, you really must select your patients very, very carefully. So why was this particular procedure suitable for Mike? Well, I think a hybrid approach was the right one for him. He needed to get as many grafts as possible to meet his expectations. I think that he's been able to maximize the yield by doing the combination of FUT and FUE. His donor area still looks great, so he could definitely go back and do a second FUT if he wanted to, or he could do another hybrid procedure, or he could just do FUE alone if he preferred the probably slightly easier recovery when it comes to FUE. So that's it really, and I'll let you get back to the podcast. Yeah, okay, that makes sense. I mean, he has sort of very much got a niche of doing the biggest procedures in the UK. Combination of FUT or FUE or FUT alone or even FUE as well. So he's doing big procedures and doing big transformations. And obviously for some people like yourself, that's what you needed. And perhaps if it wasn't for him doing these big procedures, you wouldn't have gone ahead and had a hair transplant. You may have just left it.
Yeah, I think so. I'd already decided that I probably wasn't going to go to Turkey.
Mm,
I certainly wouldn't be flying to Brazil or wherever you need to go to, get the equivalent.
mm.
Um, and yeah, I think it's good for people to have that option to stay in the UK and get that kind of procedure.
And just tell us a little bit about the procedure itself, because it's something that a lot of people have talked about, but until you go through it, it is a procedure like nothing else, because you have this day, you have all this build up, you have the day, and then you have 12 months of waiting, which is, I think, is the most difficult part of the whole procedure is the waiting game. And it sounds like somebody you were like, come on to get on with this. I don't want to mess around having two procedures. Just get it all done in one.
Patience is not my strongest quality for sure. I was lucky though with the regrowth because it actually got to the point within pretty much 4 months where it looked pretty decent. Um, and I think almost if you're completely bald to start with, then you get that kind of initial bit of regrowth for a couple of weeks or whatever it is straight after the procedure, and you think, yeah, that's going to look good, and you kind of get to see like what the hairline's going to look like, and then it all falls out as you expect, and then you're
Yeah.
just back to being bald again.
Mm.
Um, the only downside is you've got a little bit of a red head, I guess,
Yeah.
which does fade. I think it faded within a couple of months, I think. Um, so I didn't really look that much different to how I looked before. And then it just started to grow and it actually came in pretty quick. Definitely by 5 months, I was like, yeah, this looks fine now. And it's just continuing to improve. So I'm at 10 months now. Once you get the initial anesthetic out of the way, which was way less traumatic than I thought it was going to be. Like I probably
Yeah.
only felt the first two injections, maybe.
Yeah, I think people, worry about the numbing injections too much, and as you say, you do feel them, and some of them can sting. But I think progressively, they're administered very quickly, and obviously as they go on, you feel less pain. How was the second day though? Because you obviously had this big FUT procedure done on day one, and then you've got to come in again the next day, and you've got to go through those numbing injections. Did you find the second day more challenging?
Slightly. I wouldn't say the numbing injections were more painful than the first day, maybe slightly. I don't know whether there was still a little bit of anesthetic left in there potentially. Um, but yeah, he took the injections much slower on day two, so I think if you just wait for the first injection to spread a little bit and then you go into the next place and the next
Yeah.
place and you're just kind of taking your time rather than, some lunatic just, getting
Mhm.
him in as quick as possible. Um, but yeah, I mean, it was tiring. Like it's not a walk in the park for sure. It was two roughly 11-hour days back to back. So we started at 8 and finished at about 7 both days, um, which is, if nothing else, just a long time to sit in a chair. Um,
Yeah, particularly for someone who's been so active. I mean, probably if you'd gone back to your sort of 2020 days, you probably would have been pretty well, mastered at
Absolutely.
the
Yeah.
art of laying around all day long. But you've suddenly then got fit. You lost weight. I was going to get onto that actually about how you found the recovery, because you had to suddenly become inactive again. So was there a tendency to think, right, let's reach for the Haribo, let's get the chips, that sort of thing, or your mindset had changed at that point?
No, I think my mindset had already kind of changed. I didn't
Mm.
really change my diet particularly. I just kind of focused on getting better and getting to the point where I can just carry on, my normal day to day again, which actually kind of comes fairly quickly. Um, so I just used the opportunity. I think I had about 10, 12 days off work initially. Um, and then, yeah, just carried on as normal once the recovery had sort of got to the point where I could lift weights again and get more active. Then I just, yeah, just carried on where I left off really.
And when was that? Because people over the years have always, worried about when can I get back to the gym, when can I exercise again. So when did you get back, start to build things up again?
So I went after a month basically, and just kind of gradually built up. Um, I think for me, even if someone had told me you can't exercise for 6 months or 4 months, or
Mhm.
the amount of muscle that I would have lost and the amount of progress that I would have lost in that time probably would have made it not worth it. Um,
Right.
because it's very hard to get that back.
Yeah.
When you're 45, the amount of muscle that you would lose from doing no lifting whatsoever for 4, 5, 6 months, you'll find it very hard to get that back.
Because there is a talk of FUT and weightlifting as to whether it stretches the scar at all. And that's always been a bit of a hot topic. Not so much with FUE, because obviously you don't have that stretch, but people have always talked about there's certain weights that you do that may put any sort of resistance on the scalp. Did you feel, because you had a big procedure, and I know that you combined it with FUE, but did you feel any tightness at the back of your head after the surgery once the stitches came out?
Yeah, I mean, immediately after stitches come out, it's quite a big relief because it feels like
Oh
it's
yeah,
loosened. If anything, it feels great.
yeah,
But yeah, maybe a little bit. Nothing now. 10 months in,
no,
I can feel where the scar is, but there's no sort of additional pain or anything like that there.
okay,
Um, I did build up. I never really went back to kind of maxing out lifts and things like that for a good few months. So built up kind of slowly, just
right.
did higher reps, lower weight, things like that. I certainly wasn't doing, big deadlifts or,
Mhm.
straining, really heavily.
Big Deadman lifts. We can call them now, can't we?
Yeah, they need to be renamed.
Yeah, so I've always people always said to me, when can I do weights after FUT? Is there any worry about it's going to stretch the scar? And I think there's obviously there's never been any research on this because people just don't do it. They generally, like you, is probably take a bit of time out, maybe a month, and then build things up slowly. I think your body tells you what you can do and what you can't do in those early months.
Yeah, I think it probably depends on how important it is to you and your lifestyle. Like, even if someone had said to me, wait 6 months, I would have ignored them anyway, because
Yeah.
for me, the muscle would be more important than any kind of change to the scar.
So you saw the growth come through, and you're now at 10 months, and you said that at month 4, I guess because you had, with the greatest respect, very little on top by the time you had the surgery, is that it's an easier way of assessing the outcome of a procedure, the success of it, because you've gone from nothing to having where you are today, which is an amazing transformation. Some people, obviously, when you have a thinning area, then adding more hair can be something sometimes a bit more subjective in terms of like whether you've had a great outcome or not, and you have that conversation with the surgeon. But in terms of your expectations going into it, because I think that's always something I find with patients is that expectations are key to a successful hair transplant. And at 10 months, how do you feel the hair transplant is compared to your expectations prior to having the procedure?
Yeah, I mean, it's massively exceeded expectations. I mean, not just in terms of the numbers, like to get, the fact that he tentatively said 6,000, maybe, if everything's perfect, then maybe 6,000, probably more like 5,500, and then you get almost 8,000. Um, that's obviously had a massive impact on the quality of the result. And I think I sort of went into it thinking I didn't want nothing on the crown, but I
Mhm.
could I could deal with it just being a little bit kind of thin in a sort of age appropriate way. Um, but it's still fitting in now, and it's maybe there's a tiny, it would look like he's just maybe starting to lose a little bit of hair as opposed to he's going to go bald any minute.
Yeah, well, you'd
So
take that, wouldn't you? You'd take that
yeah,
really with regards to, and the crown can take up to 18 months. So there's potential that you will still see thickening of the crown over the course of the next 6 months if you're only at 10 months now. But yeah, I think expectations are really important that patients understand that. But I think there's always a danger in your situation where you've gone in planning for 5, maybe I might get 6, and then suddenly you've got 7,800 and whatever it was, and then your expectations suddenly shoot up again because you're thinking, wow. And I remember that I did exactly the same thing, because I went in planning for 3,500, maybe a little bit more, and I ended up getting just short of 5,000 grafts. This was in 2006. And I was so over the moon that this idea of all these extra grafts after having 3 procedures, that you kind of start dreaming of like an Elvis sort of style hair. And whilst that's lovely that you've got great coverage, I think obviously I always say to people about hair transplants is that it is an illusion still. You still have to style your hair. You can't just rock up out of bed, unless you don't care, of course, and expect it to look amazing. And, there's still a little bit of effort that you need to do, because it's not replacing hair for hair that you lost. But when it's done well, with the right distribution of singles and doubles and triples and the right number of grafts, you can have what looks like a full head of hair.
Yeah, definitely. I've definitely find it a lot better kind of swept across.
Yeah.
For me, that works really well. Yeah, like you say, if I could probably part it in a certain way and it would look a bit thinner. But yeah, if you put the effort in, then yeah, it's definitely the illusion is definitely you can kind of I've got very bright video light, and if I sort of part it, maybe you can see like a little bit kind of showing through. But as long as you just keep it roughly kind of brushed over, and it still looks really good. But like
Yeah.
you say, if you replaced it, like for like density, then you'd have no hair at the back either, would you? You'd
No.
have to literally move all of that hair up there.
Yeah, and this is unfortunately where people get sort of hair greed, and it sounds like you're not going to do that because you've got a great result and you've moved a lot of hair. But often people go back for a second procedure because they're in your situation now where they're like, well, I love it, and the experience was great, and they actually get quite an enjoyment, because I think at 4 months, when you start to see that hair change, and you're looking in the mirror and you're seeing hair increase month on month on, rather than seeing those years where you looked in the mirror and you saw it thin month on month. There's something about it that drags people back, because it's such a nice feeling,
Mm.
that often people go back for a second procedure, and it seems like you've got the ability to do that, if you wanted to. But it sounds like you're not going to, because A, I don't think you need to, and B, you wanted to get this done in one go.
Yeah, I definitely don't feel like it's necessary. Like we have had a kind of very vague chat about what could be done in the second procedure, because like you say, there are grafts available.
Yeah.
And I'm a little bit 50-50 at the moment, because
Okay.
I don't feel like it's necessary at all, because like you say, like to go from where I was to where I am now is, like a great result, and it could very easily just stay as it was. But then at the same time, I could have stopped losing weight when I got to 17 stone and been fine. There was no need to carry on and get down to 15 and get a six pack and get shredded and have a photo shoot and start a fitness business and all that kind of stuff. So I'm not the kind of person who stops at okay, if that makes sense.
Yeah.
So yeah, whether there's an opportunity to go back and just get a little bit more density. We've talked about maybe adding in like a little bit of shape just in the temples, just a touch, just to kind of frame the face a little bit better. Um, but yeah, like I say, I'm a bit torn, because I don't feel like it's necessary in the slightest, and the result's great, and the hairline's amazing, and very happy. But also, there's that kind of nagging thing of maybe it could be a little bit better. So yeah,
Yeah,
we'll see.
well,
Watch this space.
yeah, watch this space. I mean, it always can be better. And I've had 8 hair transplants, and I've had probably over 10,000 grafts, but I've done it over eight hair transplants. So, but yeah, I mean, I think that there's always the ability to do more. You've got to be careful, and that's where people can go down a bit of a rabbit hole of having more and more procedures to increase the density. I think 2 or 3 procedures for somebody who was a Norwood 6 is kind of expected, really. So for you to do all the no pun intended, well, actually, lots of pun intended, the heavy lifting in one go, then the rest of it is just the tweaking of things. So I'll be interested to see whether you do go back for a second procedure or not. But at least it's in your, you don't have to now at this point. That's the beauty.
Yeah, that's exactly where I wanted to be, where I wanted to get to a place where I
Mm.
felt like it looked good straight after the first one, which is exactly where I am.
You started finasteride a while before, I think you said 6 months before or so before your hair transplant, and you were in the middle of losing weight, building muscle. And again, another thing about finasteride, and there's loads of people worried about it, that they're going to lose muscle tone, they're not going to be able to build muscle. So, have you noticed any kind of changes at all with that on finasteride?
Haven't, although I need to qualify that by saying that I was on TRT before I was on finasteride, so
Yeah.
the chances of me getting lower testosterone, like if my testosterone had been made lower, then it would have been counteracted by having slightly more
Hmm.
TRT to get to
Yeah.
the level that I wanted to be at. So yeah, I don't know how that would have affected me had I not been on TRT. Like I had low testosterone to start with, so I guess
Yeah.
there's the potential that it would have made it very low.
Mhm.
Um, so yeah, I guess in a way I'm lucky that I kind of had TRT before I even considered starting finasteride.
Yeah, but you've not seen any changes in how you've been able to build muscle, keep muscle, obviously on finasteride, or you've not seen any other side effects from
No, not
the
at all. I'm
combination.
actually on dutasteride now, and I haven't noticed any kind of side effects in any of the, anything that people talk about, mood or losing muscle or any
Yeah,
kind of sexual problems, anything like that. But like I say, I'm also on TRT and I take low dose
yeah,
tadalafil, so it kind of cancels it out.
yeah. Of course, but you're also riding the wave of having this huge transformation in your weight. I mean, you must look in the mirror still at times because it has been such a transformation for you. It's not just been the weight loss; it's been the hair. And I mentioned before we came on that often people have the hair transplant and then they do something about the weight. Obviously, you did that the other way around, and they fix the thing that maybe bothers them the most first. For that was you. It obviously was the weight. For a lot of people, it's the hair, because when they look in the mirror, they don't see themselves. And often they then losing the hair, putting on weight. So it's great that you've had this amazing transformation. And you did this article about on the Daily Mail. So just tell us a little bit about how that came about.
Yeah, that was an interesting one. So I obviously after starting the business, I was just looking for general bits of PR and things like that. And the Daily Mail health section was keen to do a story. And it ended up a double page spread in the Mail on Sunday, and online as well. Um, so yeah, really good. I got lots of kind of new interest from it, and
Mhm.
also lots of very interesting comments of I actually got pasted them all into ChatGPT and got it to analyze the percentage of comments, and I think it was something like it was well over 1,000 comments. I think it's up to about 1,200 now,
Wow.
which actually got more than a story about Kate Middleton on the day that it was published, which I was fairly impressed with. But at least 75% of people either assumed it was Photoshop or AI. The comments were just full of people saying that is not the same guy. That is, he's made it up. It's photoshopped. It's, you know, AI. We're supposed to believe anything these days. What do the Daily Mail think we are, idiots? All these kind of comments. Um, and I kind of took it in a pretty positive way, to be honest,
Yeah.
because change that people just
Yeah.
instantly assume it's Photoshop or AI, then
Yeah.
I've done a decent job.
Obviously, people can be pretty cruel on particularly on the Daily Mail comments. I think that's one of the harshest place you can end up finding these comments. But did you take any of it to heart, or did you kind of think, well, okay, I've done that. I've got these changes. I guess if people were commenting about your weight or you were bald before, well, that's the old you. That's the old Mike. You've changed that now. So it's difficult to really bash somebody when they've made such a positive change.
Yeah, and I think the fact that people just thought that it was fake was, you can frame that however you want, right? But I
Yeah.
think the fact that people assume that it's fake must mean, and the fact I know it's not fake means that it's pretty amazing the transformation between the start and the finish.
Yeah, absolutely. Well, well done for doing it. It's very brave of you getting on the Daily Mail. But just tell us a little bit about how you've obviously set up your business and what you're offering people who are interested in losing weight, getting fit, building muscle.
Yeah, so I started the qualifying as a PT course a couple of years ago when I was kind of into the journey and learning a lot
Mhm.
about fitness, and thought, maybe this is something I want to learn a bit more about. Didn't really know where it was going to go, but I started the Fit Dad program,
Yeah,
which helps loads of dads. I've got a free WhatsApp group that people can join to help them out with any kind of tips or advice on weight loss. I've got fixed length programs, anything from 6 weeks to 100 days, where you can join me, and then you get private communities, you get private WhatsApp group, you get your fitness programs, you get your nutrition guidance, all of that kind of
mhm.
thing. Then I also coach people one to one as well, who want a really specific result or a bespoke program. Everything's done online, but they're
Yeah,
kind of split off into separate WhatsApp groups with
mhm.
the programs. So the program itself is delivered on an app. So you get all of your training sessions, all of your nutrition targets, daily habit tracking, and
Yeah.
things like that, all through an app. And then on the group programs, the support is via the WhatsApp group, which works really well because people support each other as well as me supporting them. So you get a really good kind of community feeling. And at the moment, over 80% of people who complete one of the programs move on to another.
Right.
So it's just that kind of sense of community really helps that.
And it's all guys as well. So you say it's the Fit Dad program, but it's all chaps that you have in the program.
Yeah, I mean, it's basically designed to help the old me. So I kind of look back at where I was
Yeah,
in, my 30s and 40s, early 40s, and I'm just trying to help that person to just
yeah.
get more energy, lose the weight, feel better, look better, get more confidence. It's not about getting shredded or getting ripped. It's just about getting that energy for the kids, no naps on the sofa at 5 p.m. or whatever, and just, being that kind of engaged and enthusiastic, strong, capable guy.